Hi there, I'm Kristina. I'm the Infection Preventionist for Johnson County Healthcare Center, and today we're going to talk about social distancing and why that's important, what it means to us here in our community in Buffalo, and I'm sure you've heard of this term, flattening the curve. We're going to talk about that as well, and what that really means for you in your practical everyday life. So let's do some math first. We have about 4,500 residents here in Buffalo. The CDC estimates that 40 to 70% of Americans will get COVID-19 by the time this is all said and done. So if we do some simple math, let's estimate on the low side, say 50% of our residents here in Buffalo are going to get COVID. That means 2,250 people in our town are going to get sick with COVID. CDC also estimates that of the people that get sick, about 20% are going to need extra care. Now the good news is that means 80% of us that get COVID are going to be just fine. We're going to have mild cold, flu-like symptoms. We're going to stay home and rest and self-isolate and take care of ourselves, and we're going to be just fine. What I want to focus on is this 20% of us that are going to get sick that are going to need care. Now, so 20% of that is 450 people. Now, this is just an estimate, don't quote me on this, but about 450 of us are going to need extra care. This number actually might be higher because the population of Buffalo, 60% of us are older than 50, which puts us in a higher risk category for having complications of COVID-19. But let's just say, for the sake of argument, 450 people in our town are going to need extra care, meaning they're going to need our services here at the healthcare center. They're going to need nurses and doctors and special equipment and oxygen and all those things that we're going to need to provide for them. So how does this tie to social distancing? Well, currently in the United States, we've passed the point of being able to contain this. Because we've seen community spread in other parts of the country, we know that it's inevitable, it's going to come no matter what. So we're at the point of mitigation. What we want to do is we don't want these 450 people to get sick all at the same time. It's really important that we spread out the illness so that we don't overrun our health system. I'm sure some of you have seen reports in Italy. They didn't do a good job of this. They didn't act quickly enough, and so they're having to make some really harsh decisions. Like who gets a ventilator and who doesn't, basically who lives or who dies. They have ICU patients in the hallways. Their health system is completely overrun. So that's what we're trying to avoid. The reality is people are going to get sick. We can't stop it at this point, but what we can do as a community is come together and spread this number out. How do we do that? We do that by social distancing. I know having kids at home, not being able to go to events, all those sorts of things that we're doing is really hard. I have teenagers myself, and they're having a hard time with it. But it's really important that we understand the bigger picture and what that means. Okay, so say this is you, and you're in your house with your family of 4. You have friends down the street that also have a family of 4. And here on the other side of town, they also have a family of 4. Now the family in this house, the dad has to go to work. He has a vital function, whatever that may be. So he goes to work and he's exposed to his 10 coworkers. He comes back home, that means this 4 people are now exposed to 14 people worth of germs. So you think, oh, Timmy, he's so bored. If we could just I'm just gonna have our neighbors come over and they're gonna play and it's gonna be fine. So the 2 neighbors come over. Okay, now those 2 kids have now been exposed to 14 people's worth of germs. So they're going to come back. That 14 is going to get added to this family. Now this family is carrying around 18 people's worth of germs. So then you say, oh, I'm just going to walk over and have a beer, right, with this neighbor. So this person from this house is going to take their 18 people's worth of germs, come here. Now this house is now carrying 22 people's worth of germs. So, and on it goes. Now we know there's no way to completely isolate people. It's just not practical. So what this is a numbers game. What we need you as a community to do is to decrease this number as much as we possibly can. And in that way, by the time the virus gets to us, because it will, we can slow the progression of the illness. This number can come in over a longer period of time. We're still going to see sick people, but we want it to happen over a much longer period of time so that we don't overwhelm our health system. So what does this mean for you at home? It means no slumber parties. It means no play dates. It means avoiding things that you can possibly to not expose yourself to other people. Because remember, 80% of you that get it are going to be just fine. But what we need to do is spread out this number of the 20%. Okay? So please, do your due diligence. This is an amazing community. I've already been really impressed. You know, as I'm driving down the street, I see that businesses are only having their drive-through open. We have people, you know, I think doing a really good job. But it's important to realize that just those few isolated incidents of going to the neighbors can really add up over time. So, thank you.